Assalamualaikum warahmatullahi wabarakatuh. Good morning, my friends. Let me introduce myself. My name is Duta Mahaparana, number 50. Okay, my friends, in this presentation, I will discuss about thrombocythemia. Topics to be discussed: the first, thrombocythemia; second, causes and symptoms of thrombocythemia; the third, thrombocythemia diagnosed and treated; the fourth, living with thrombocythemia. Thrombocythemia is disease in which your bone marrow makes too many platelets. Platelets are blood cell fragments that help with blood clotting. Have too many platelets make it hard for your blood to clot normally. This can cause too much clotting or not enough clotting. Causes and symptoms of thrombocythemia. Cause thrombocythemia. There might be no single cause for thrombocythemia. It is believed to be caused by defect in the bone marrow platelet-making cell. Symptoms of thrombocythemia: blood clots in arteries and veins, most often in the hands, feet, and brain. Bruising easily. Bleeding from the nose, gums, and GI. Gastrointestinal tract. Bloody stools, bleeding after injury or surgery, weakness, headache and dizziness, swollen lymph nodes. The symptoms of thrombocythemia may look like other blood disorder or health problem. Always see your healthcare provider for a diagnosis. Thrombocythemia diagnosed and treated. Your healthcare provider will take your health history and give you a physical exam. You may also have tests such as 1. CBC or complete blood count. This test measures the amount of red blood cell, white blood cell, and platelet in your blood. 2. Blood smear. This is a way of looking at the blood cells using a microscope. 3. Bone marrow aspiration of biopsy. This is may be done to see if your bone marrow is healthy. It involves taking a small sample of bone marrow fluid aspiration or solid bone marrow tissue or core biopsy. The sample is checked under a microscope. Treatment will depend on your symptom, age, and general health. It will also depend on how severe the condition is. Treatment generally is done to ease symptoms and reduce the risk of having blood clots. Treatment may include: first, low-dose aspirin. This is for people who are at risk for clots. Second, chemotherapy. This is often may be given as a pill or injected or both. Oral chemotherapy may be called hydroxyurea or anagrelets may be given with an injected medicine called interferon alpha. The third, platelet This is a procedure to remove platelets from your blood. It is rarely needed for this condition. Living with thrombocythemia. Work with your healthcare provider to develop a treatment plan that meets your needs. It is also important to, first, not smoke, which may increase the risk of blood clots. Second, control other health conditions such as high cholesterol, high blood pressure, and diabetes. The third, tell your healthcare provider if you notice bruising or other sign of bleeding. Key points about thrombocythemia. Thrombocythemia causes your body to make too many platelets in the bone marrow. Too many platelets can cause blood clot or bleeding. Symptoms include blood clots, and signs of bleeding, such as bruises, bloody stool, and weakness. There may be no single cause for the disease. It is believed to be caused by defect in the bone marrow's platelet-making cell. Treatment includes medicine to control the platelet count and, in rare cases, removing platelets from the blood. Thank you for your attention and wassalamualaikum warahmatullahi wabarakatuh.